Welcome to the Population Health Management Podcast, brought to you by Lightbeam Health Solutions. My name is Laurel Derr, and I will be your host for today's episode. Hello, and welcome to our podcast today. If you have tuned into our past episodes, you probably know our speakers today. We have DiNoia and Shelley Davis. Both of them are registered nurses and on our clinical transformation team here at Lightbeam Health Solutions. So welcome, Christine and Shelley.
Hi, Laurel. It's great to be back again.
Hey, Laurel and Christine. Thanks so much for the invite to join again.
Well, I really appreciate you coming on. As you know, tomorrow is World Health Day. So we wanted to focus a little bit on social determinants of health. And Shelley or Christine, could you kick us off for those who don't know what social determinants of health is and let us know a little bit about it?
Absolutely. I am very passionate about social determinants of health. I think it comes from my experience of being educated in an inner city, as well as my background in care management. And for those who don't know, when we talk about social determinants of health, what we're really talking about is where someone truly is in their life, where they live. They're the conditions in the environment where people are born, where they live, where they learn, where they work, where they play, even where they worship. And as you can imagine, each of these factors can impact their health, their quality of life, their physical, mental, spiritual, and emotional well-being. And when someone has access to safe housing and reliable transportation, or they live in a safe community, the level of racism, amount of discrimination or violence that someone is exposed to, the various job opportunities or availability to be maybe a higher income wage earner, availability and access to nutritious food and good diet choices, the ability to engage in physical activity on a regular basis, factors that feed their language and their literacy, even the quality of the air, water, and noise around them are all considerations, and they all pose social determinants of health. And these factors together and individually will lower or elevate someone's risks or improve or worsen their health and personal outcomes. They also contribute to wide and widening health disparities, because if you can imagine those who live in a location who don't have access to fresh foods, fresh bread, fresh fruits, fresh vegetables, they are more likely to experience poor nutrition. And what research has shown us is that this increases the risk, incidence, and severity of things like heart disease, diabetes, and obesity. It also lowers their life expectancy compared to those who do have the means and the access to fresh food, the knowledge to make good nutritional options. And in this country, it is a hard and sad truth that it is much cheaper to choose a meal from a dollar menu at a fast food restaurant or select inexpensive convenience store foods than it is to buy a quality, nutritious meal.
Yeah, Shelley, that's so true. And as providers are increasingly held accountable for reaching population health goals while reducing costs, it's important that they have the tools and the strategies to identify those upstream socioeconomic drivers of poor outcomes and the higher costs. And so with the data on the social determinants of health, our clients can define and document the increased complexity of their patients and really transform the care with integrated services and community partnerships to really meet the needs of those patients and advocate for their change in the communities, and then demonstrate the value by what they bring to the patients, the communities, as well as the payers.
Absolutely. And I think it's very easy to see when you do a quick review of the social determinants of health, it's very evident how these contributing factors and conditions can have a profound impact on health outcomes and healthcare utilization and on spending. And while this is something I think that's been long understood, because I think you can see the links out in your own community, you can see the links in other communities. There has been an increased focus on addressing some of the gaps created by social determinants of health. And there have been several reasons that have influenced this. The first is that we know that addressing and closing some of these gaps improve health outcomes and help to control costs. A healthcare organization is only as healthy as the community it serves. Also, there are some new state and federal laws that now require or encourage healthcare organizations and stakeholders to demonstrate a coordination with community partners and social support organizations. The shift from CMS away from a fee-for-service to the value-based model really has again refocused on outcomes, and organizations recognize the need to become partners in addressing some of these factors, because someone with uncontrolled diabetes who cannot access nutritious food or quality preventive care will absolutely have a poor outcome. Someone who experiences food or housing insecurity will access the emergency department or emergency care more often, and research has shown us that. When looking at our dual eligible population, and those are, for those who don't know, those who qualify for both Medicaid and Medicare, they are typically either low-income seniors, those seniors who have higher costs related to their incomes, or those who have disabilities. This population is certainly at risk for gaps in social determinants of health, and MCOs and MA plans. These critical stakeholders feel compelled to address the societal gaps. Managing chronic conditions, ensuring the satisfaction and achieving those quality measures that are tied to Medicare and Medicaid payments now mean meeting beneficiaries where they live in all aspects of life. And it also requires multiple modalities and, quite honestly, out-of-the-box creativity and thinking. And when we look at social determinants of health, they're really delineated into 5 focus areas or domains, and I can go into that next. The first 2 domains really are interwoven: economic stability and access to education. According to the National Institute of Health, about 1 in 10 Americans live in poverty, and there are an even greater number who, while they may earn above what's considered the national poverty line, they still struggle to afford healthy food and quality health care, safe housing, or be able to aspire to those educational opportunities. And research has also shown us that those who grow up with this level and type of insecurity and who have lacked access to quality education are more likely to struggle with everyday tasks that include math and reading. Also, the constant stress of living with these insecurities further impacts school and then job performance. It eventually becomes a downward pivot, as these then lead to lower paying jobs. There's fewer opportunities for upward mobility. There's an increased incidence of social discrimination, and the stress from all of this, again, increases the incidence of heart disease, diabetes, depression, obesity, so many different conditions in health. 2 additional domains that they look at are neighborhood composition and community or social context. Again, these are 2 very different but very related domains and factors. And those who live in areas that are considered unsafe, those who are exposed to violence or exposed to the risk of violence, those who have poor or lower air quality, noise quality, water quality, all of this deepens stress and really shapes development, aspirations, and motivation. And in terms of community, they may be surrounded by people, but they may also be isolated and lacking in social support. They may not have access to community centers where they do have mentoring and tutoring available, after care, after school care, before school care, local groups like the YMCA, Boys or Girls Clubs, places where there is an ability to connect and be cohesive to your community and to your neighbors. All of that, if they don't have any of that, it really creates a negative cycle where if they don't benefit from positive relationships and positive role models, then they therefore don't, number one, they don't know how to improve themselves and to make good choices, but they also don't then contribute and give back in sort of that civic-minded service. Finally, the last one, and the one that's probably something that Christine and I and Lightbeam is focused on, is access to healthcare. And when you're talking about access to healthcare, those who are impacted by negative or gaps in their social determinants of health are less likely to have a primary care provider. They experience a lack of coordination of care. They miss out on preventive screenings, which often catch new diagnoses early and are therefore more manageable. They also have other barriers that may impact healthcare, such as transportation. There may be a language barrier. There may be a literacy barrier. So when looking at that fifth domain, access to healthcare, all of that sort of is tied together. And it's very easy when you take a look at social determinants of health and you consider all of those different factors and the way that people live and where they live, you can see how they can have a profound impact on health outcomes, healthcare utilization, and healthcare spending. And while this is something that seems very, very simple in concept, very evident, and it's been long understood, there has been an increased focus on addressing social determinants of health. And there have been several reasons that have influenced this sort of renewed focus. The first is that we know that addressing and closing some of these gaps improve health outcomes, and that they also help to control costs. If we can get people to be able to have greater access, more nutritional choices, the knowledge to make decisions, if they have a sense of community, if they have mentors and a social support network, they are going to have improved outcomes. And we know that. The research has shown us that.
Absolutely, Shelley. I was wondering, Christine, could you elaborate a little bit on what Lightbeam is doing with social determinants of health?
Sure. We as a company have thought that it was super important to be able to seamlessly integrate assessing social determinants of health into the workflow of the care managers. So we decided to select the Prepare assessment tool. And like Shelley mentioned earlier, the 5 pillars, it basically, the reason we selected the Prepare tool is because it consists of a set of national core measures as well as a set of optional measures for community priorities. In the Prepare form, it was developed by research and the experience of existing social risk assessments and also stakeholder engagement. It was validated and it aligns with national initiatives prioritizing social determinants of health. Like, for example, Healthy People 2020 measures proposed under the next stage of meaningful use, and as well as clinical coding under ICT 10. So Prepare emphasizes the measures that are actionable, and that's what we really thought was important about it. So we embedded it on our platform, and it's a scoreable assessment. So when each question is answered, it actually gives you a score at the bottom of the screen, and it'll show you the total score as you go along. And then you can drive the action for that as well, or you can pull any of the questions either singularly or as a group of questions into a cohort criteria and pull any of those patients that answered, say yes, or a specific response to those types of questions. And some of the questions, depending on the response, suggest ICD-10 codes if a client wanted to use it for more robust billing practices. And then our Prepare form also couples well with the optional Aunt Bertha community resources. So if selected, we can link out to the appropriate resources as identified by completing that Prepare form within our system that are specific to that patient and in that location as well. So it makes it super efficient workflow for the care managers. We do also have other options within our platform for social determinants of health as well. And we realize, and the reason that we did that is because we realized that you have to decide which tool best aligns with your organizational initiatives as well, and as the relationships that you may already have with the community resources. So what we did was we took some of the validated screenings out there, some of the combination of them, and created 2 other optional standardized assessments that are completely customizable. So what that does is allows clients to address the issues that they're best suited to address. And if your organization doesn't have the capacity to tackle the comprehensive Prepare assessment, one of these assessments might be a great place to start. any option is a great start. And even if your organization isn't ready to address social determinants of health, it's a great way to provide insight to inform care plans, and really allows all levels of the care team to provide truly individualized care. And we can help, the clinical transportation team can really help you to integrate any of the options into your workflow and personalize the engagement throughout the patient journey.
I agree. And Christine, I think you're talking about two of my favorite aspects of Lightbeam, the cohort builders, as well as the social determinants of health functionality, because I think that it gives, when we talk about out of the box thinking and really coming up with creative ideas, it gives healthcare organizations and providers an opportunity to really target populations who may have some housing insecurity, who may have job insecurity, who may have food insecurities, and really be able to equip the local care managers to partner with nonprofits and community resources. Really, because what we've learned is that health promotion is not enough. It's no longer just putting up a sign in your office that says, that all the different reasons that smoking is bad for you, or how to test air quality, things like that.
Agreed, Shelley. It's really a holistic look at the patient. So, and this definitely helps to give a better picture of what's going on socially versus socioeconomically versus just medically.
Absolutely.
And it looks like we're kind of at our time. First off, I want to thank you again for being on the podcast. This has been a lot of great information, and I know people might be wanting to know more. So I'm going to share both of your contact information. So if anyone has more questions, they can reach out to you. And do you have any additional resources that you think would be helpful for our listeners?
Absolutely, Laurel. And thanks again for having me. I always enjoy meeting with you and Christine. I know that she's already mentioned Aunt Bertha. Certainly the United Way is also a wonderful resource, as well as the local YMCA, for addressing things like community housing, food insecurities. Christine?
Yeah, we could also include some additional information on the prepare form. So if your organization is wondering about how it was created, or any of the information or questions that are included within it. So we'll include some links within the information section of the podcast as well. And thanks again, Laurel and Shelley. It was a pleasure.
Thanks again, Shelley and Christine. We'll be hopefully talking soon, and you guys will hear from us on our next podcast.